So our webinar is entitled Connecting with the Community, Food Insecurity and Hunger. I wanted to just say a few words about the FMEC. I've been a member for many years. It's the catalyst, convener, and an incubator working in 14 states and DC in the Northeast United States, serving 60 medical school departments of family medicine and 195 family medicine residency programs. The FMEC promotes family medicine and primary care to impressionable medical students. We support residents as they transition in their careers. We strengthen academic family medicine, promote quality improvement initiatives, and stimulate innovation in primary care service delivery. Before we get to our topic, I wanted to kind of set the stage by asking a few questions and talking about why we are here today. Certainly as family physicians, for those of you who are primary care providers, social determinants of health is something we've been aware of all our careers. We know that our patients struggle financially, that they have to deal with harmful environments, poverty, but I don't think many of us really saw how that could be part of our role in primary care. I mean, what could we do when we were already struggling with handling the medical issues? So why have social determinants become more important in primary care? Well, this one picture shows you that what makes us healthy, medical care accounts for only 10 to 20% of what makes us healthy and prolongs our lives. Even though we spend 88 cents on the dollar for medical services, we can see that healthy behaviors, environment, some genetics, but the social determinants of health are far more important. We also know that the United States spends more money than any other advanced country for healthcare, but has poorer outcomes than most of those other countries. We know that payment models are changing from paying for what we do, or fee for service, to managing the total cost of care. And because medical care affects only 10 to 20% of population health, we realize that we have to address non-medical health factors, which impacts the other 75% of population health. And that means changing our perspectives and partnering with important community agencies in order to do that. It makes sense if you think about Maslow's hierarchy of needs, which I think most of you have heard about, but basically Maslow said that before someone can reach the top of the pyramid where they achieve self-actualization, raise their esteem, feel love and belonging, they first have to live in a safe environment, and they have to have their physiological needs met. And we know that. We're telling our patients to get a test done or to take their drugs and pay their co-pays, but if they can't afford it, if they don't have transportation, those needs thwart their being able to rise up this pyramid. Social determinants of health encompass a wide range of factors. And today we're going to be talking about food insecurity, hunger, and nutrition, defined as not having reliable access to enough affordable, nutritious food. Before our speakers give their presentations, we have two polls. I'd like all of you in the audience to click your responses to the poll. So just two questions. The first one is, how prevalent do you think is food insecurity in a primary care practice? Do you think it affects fewer than 10% of patients, between 10 to 25% of patients, over 25% of patients, or you don't know? So if you could just take a minute to choose your option here, and we'll show you how the group polls. And then you want to show the results of that poll?
Sure. The results are on the screen now, Mitch.
We don't see them here. Here we go. So most of you thought over 25% of patients have food insecurity in a primary care practice. Nobody said they don't know. So we'll see what our speakers have to say about that. And our second poll question, Scott. For patients with food insecurity, how confident are you that a primary care practice can help? Do you have no confidence at all? Are you somewhat confident? Are you very confident? Or honestly, can you say, I don't see addressing food insecurity as a role for primary care? So we'll give you 30 seconds to make your choices there.
Looks like we've got all the responses, so I will share the results.
So about a fourth of you said not confident that primary care practice can help, somewhat confident for half of the people, and very confident. And I know that our speakers didn't vote, so that's out in the audience. And just one person questions whether addressing food insecurity is a role in primary care. So I want to introduce today's speakers. Let me start with Dr. Andy Goodbread. He's a family physician. He serves as Associate Program Director for St. Luke's Family Medicine Residency, Anderson campus. He's a graduate of Moravian University, earned his medical degree at Temple University School of Medicine, and completed his residency training in family medicine at St. Luke's Family Medicine Residency, Bethlehem campus. Dr. Goodbread practices full spectrum family medicine. He serves as team and school physician for his local school district, and he's board certified in both family and lifestyle medicine. Next, I'd like to introduce you to Tracy Simmons, MPH. She is senior manager on the health systems innovation team at Feeding America, an organization based in Chicago, where Tracy is right now. She joined Feeding America in May of 2017. In her current role, Tracy manages strategic thinking and program development for healthcare partnerships and leads the organization's health equity initiatives to advance network learning. She advances competency development and promotes action on ways to address food insecurity, health and equity through partnerships and interventions. Tracy's background in public health promotion and community health interventions complement her passions for advancing health equity and leveraging individual and community voices to influence shifts toward collective systems change. Welcome, Tracy. And finally, Dr. Megan Grega is the co-founder and chief medical officer of Kellyn Foundation, a 501c3 nonprofit dedicated to making the healthy choice the easy choice throughout the Lehigh Valley in Pennsylvania. She's a graduate of Bucknell University, earned her MD degree from the University of Pennsylvania Medical School, and spent several years as a medical officer in the United States Navy. She is honored to serve as faculty for the St. Luke's University Health Network programs and the Health Network Anderson campus for the family medicine and internal medicine residency. As clinical assistant professor for the Lewis Katz School of Medicine at Temple University, she also teaches. She is board certified in both family medicine and lifestyle medicine. So I turn the podium over next to Dr. Goodbar.
All righty. So I'm hopeful that you all are seeing my slides here. All right, so I'm going to be presenting an illustrative case to get us kicked off, and this will serve as some information that we can take with us through the rest of the presentation. So we'll call this an illustrative case, Adventures in Precepting. So there I was. It was a beautiful Tuesday afternoon, spring day, sitting in our precepting room, working with the residents, feeling very pleased with my work as a faculty member. Medical knowledge, check. Communication skills, interacting with the residents and the patients, check. And basically just total awesomeness, check, when one of our residents comes to discuss a patient named Adam. So Adam, as it was presented to me by the resident, Dr. Goodbread, Adam is a 54-year-old Hispanic gentleman with type 2 diabetes who says he's sick of pills and really wants to change his approach to this diabetes. When I started to discuss ways that he can change his diet and exercise routine to improve his weight and diabetes, he told me that he's unable to afford fresh produce even when he can make it to the big grocery store across town, even while working 2 jobs. He also told me that his wife and he and his wife are both having trouble affording healthy food for their kids, and that the children are forced to get the reduced cost school lunches every day. The resident finished with, "Dr. G, what am I supposed to tell him?" To which I responded, well, make it so. So some points to consider, joking aside, but a tongue in cheek, as we work our way through the rest of the talk. What does food insecurity mean for Adam? And we'll have some definitions of food insecurity and what it really means generally, but particularly for him. How does food insecurity affect Adam's personal, family unit, and the health of his community? And finally, what can we be doing for him and people like him in our network, even just within our practice at the community, state, and national levels? And with that, I will turn over to Tracy.
Thank you so much. Hi, everyone. I'm very excited to be with you today. My name is Tracy Simmons. I'm a Senior Manager of Health Systems Innovation at Feeding America, and very excited just to walk through some illustrations of food insecurity from a national perspective. Feeding America is the nation's largest charitable hunger relief organization, and our goal by 2025, in collaboration with our network food banks and their partners, is to ensure access to enough nutritious food for people struggling with hunger and make meaningful progress towards ending hunger. We define food insecurity based on the USDA's definition as limited or uncertain access to enough food for all members of a household for them to live an active and healthy life. You will see in recent years, the USDA has been shifting its focus onto nutrition security. And this is really around the safe consumption of healthy, affordable foods, and really, again, emphasizes the importance of nutrition in the food quality. Once upon a time, I think as a charitable food sector, we were under the assumption that any food is okay to give to individuals and community members facing hunger. But now we understand the close intersections of food insecurity and nutrition, and definitely want to have a deeper impact on being able to support improved health outcomes by a focus on nutritious foods. And so this definition around nutrition security is really important for us to begin to kind of adopt and shape the way that we're thinking about food distribution within our network. Feeding America operates through a community and network of food banks. We partner with about 200 food banks in the contiguous US, as well as Alaska, Hawaii, and Puerto Rico, state associations as well that are on a local and national, a local level within each state to collaborate with their state food banks. And that also includes about 60,000 partner agencies, which are your traditional food pantries, meal programs, emergency shelters, schools, and other organizations. So we are really trying to move from a space of being able to rescue surplus food and also procure food in a way that is supportive of community development in order to meet the needs of folks who are struggling with food insecurity. In 2020, about 38 million people faced hunger, and that's about 1 in 8. We know that those statistics drastically changed and were deeply impacted from the pandemic. During the pandemic, about 60 million individuals sought charitable food assistance in the US. And this may not be surprising to you, as you've seen in the media and in news outlets over the last few years, the lines at food banks and food pantries wrapped miles and miles long. We definitely want to ensure that we are having a deeper impact, and our response coming out of COVID is really helping us be able to shape the way that we're providing meals. In addition, we are really being intentional about emphasizing a focus around SNAP, which is formerly known as food stamps, as a way to support long-term needs of families and really to support their food insecurity concerns within the individual family. Food insecurity already impacts a lot of individuals, as we saw by the statistics, and there are concurrent characteristics that also impact and influence food insecurity rates. We know that folks who struggle with mental health conditions also have higher rates of food insecurity. Higher rates of food insecurity are also seen within communities with individuals who have disabilities, female-headed single-parent households with children, as well as the LGBTQ+ community. There are also intersections with those who might be veterans or active military status, as well as college students. So we know that food insecurity really has a broad impact on various populations and how it intersects with identities, and we are meeting the needs through our food bank services. I think more so in what we saw coming out of the pandemic, really around the disproportionate impacts of food insecurity, particularly for people of color. The impacts are very devastating. And so we see that the rates are higher within communities of color, and want to ensure that as we're talking about food insecurity, we're also not overlooking the intersecting social determinants around employment. Food insecurity also deeply impacts hospitalization and mortality rates. And so as we are looking at these statistics, we are finding ways to begin to look at and identify root causes and really understand what those structural determinants are as well, and why these statistics are different within the populations that we serve. This graphic here is really just to iterate and illustrate how individuals who struggle with food insecurity oftentimes have trade-offs that they are navigating. And so as they're going through these coping strategies and determining whether or not to forego medication in order to afford food, forego being able to pay utilities in order to access and afford food, these are strategies that really contribute to poor health outcomes. And those poor health outcomes really just creates the cycle of food insecurity that at times can seem unending. And so we really want to ensure through our partnerships that we're finding ways to engage with the healthcare system in order to have deep impacts on improving health outcomes for the long term. Some of the health effects across the lifespan, again, are very devastating. And so we know that children who experience food insecurity in young age are more likely to also experience food insecurity in adulthood. And that can have detrimental effects on their overall health and well-being. So we see things from mental health, again, being impacted. We know that when students are hungry in school, they can't learn. And so we are finding ways to be able to identify strategies to address food insecurity across the lifespan. And as folks are aging, we know that there are chronic health conditions like diabetes, high blood pressure, heart disease, et cetera, that deeply impact and are very much connected to the quality of food that folks are able to access. And so food insecurity contributes to poor health. Poor health can oftentimes contribute to food insecurity. This graphic here is really just to show the burden, the individual burden that food insecurity has on healthcare expenditures for an individual. In 2017 or 2015, the burden on the individual who's facing food insecurity, they expended an additional $1,800 in healthcare costs compared to those who did not experience food insecurity. And collectively, this is about $77 billion worth in additional healthcare expenditures. And so if we're thinking about broader opportunities in the scope in order to reduce these numbers and reduce the burden on the healthcare system, we can think about opportunities to collaborate with food banks as critical partners in this, this journey to address food insecurity, but also to understand how that might impact a shift in positive health outcomes. So I'm just going to quickly walk us through a few examples of how Feeding America's food banks are utilizing our healthcare partnerships to screen and intervene for food insecurity within the health setting, but also to understand the broad range of activities and opportunities that exist for us to innovate and find ways to address the social and structural determinants of health. So our strategy around the way that we're approaching health and nutrition from Feeding America's perspective is really to support our network of food banks in supporting their networks, their communities, in making the healthy choices, the easy choices, and also influencing health systems to address food insecurity as a way to better reinforce nutrition. We do this through a 2-question screener within the healthcare setting itself. And this is something that was developed through the Hunger Vital Sign. It came out of the USDA multi-question survey that was narrowed down to about 2 questions, which are here on the screen, really to assess the experiences that the individual patient is having with food insecurity. And as that patient is identified as needing extra supports, they are then connected to those resources, either within the healthcare setting or within community. I also want to acknowledge that there are a broad range of other tools to assess for food insecurity, and that this is not the only one, but we definitely want to understand the range of validated tools to really help us navigate how we might be able to identify food insecurity and nutrition insecurity within the healthcare space. We've been focusing our efforts as we are screening for food insecurity as food banks to really begin to elevate SNAP and other federal nutrition programs as opportunities to support long-term food security supports. We know that SNAP is a very, very effective program in reducing food insecurity. And so as a first line of defense, we really want to ensure that for folks who are coming through the healthcare setting, if they're not connected to SNAP already and they are screening positive for food insecurity, that they have the supports that they need and they understand the strategies and what steps they need to take in order to get connected to SNAP and related programs. From there, we are also meeting their needs, their immediate needs, as they're coming through the system, to either be able to offer food distributions on the site at the healthcare setting, or again, referring them to community-based programs to receive those food boxes and food supports. Here's just another illustration of a broad range of activities that food banks and their healthcare partners are offering, things from nutrition education to screeners. Food banks were engaged in being able to offer COVID screens, of course, during the pandemic, and other opportunities around being able to help them navigate, help patients navigate the way that they are obtaining health insurance or other access to healthcare services. As Feeding America is exploring innovative approaches through our network food banks, we know that the list of activities here on the screen are not all encompassing. There could be more. And so we're really looking forward to elevating community context and utilizing our food banks for support and to co-create ways that we might be able to continue navigating food bank healthcare partnerships. Here are some examples of what folks are doing. So things from pop-up mobile distributions at the healthcare site itself, ensuring that there are meal sites during the summer months when kids might be out of school at the healthcare site. Again, SNAP application assistance, the list goes on. And so I think for folks who are joining the call today who might not necessarily know how you might be able to impact and support your communities and being able to access services to reduce food insecurity, here are just some examples. And we really do push collaboration to figure out what is going to best sit with you and best serve your community members. We've also, again, as we are focusing on nutrition, are utilizing the healthy eating research guidelines, which were developed just a few years ago. as a way to help food banks categorize and identify foods that are considered more nutritious. But we also want to acknowledge that the nutrition value is also incorporating the cultural perspectives that's needed to meet clients' and patients' individual food needs and preferences. And so as we're shifting focus again on not just the quantity of food, but the quality of food, we want to ensure that food banks have the necessary supports to be able to procure those foods at the outset and then distribute those through their healthcare partnerships. I'm thinking that this presentation slide deck is going to be available following our conversation today. So I would just encourage folks to explore the links that we have here. We have an abundance of resources that have been created specifically to support food banks and their healthcare partners in navigating partnerships. And so would encourage you to dig through these and see what you might find and utilize these tools and resources as a way to start the conversations if you haven't already, or to strengthen the partnerships that you may already have in flight. Additional resources on how we are talking about nutrition and food banking, and again, really elevating the cultural inclusivity of foods that we are procuring as a way to meet individual food needs and preferences. Our focus as well is getting at the root causes and really getting folks away from having to rely on food banks day in, day out. We want to shorten the line, and as a way to do that, we know that we have to, again, address the structural and social determinants. And so we're really beginning to embed equity within our framing as a way for us to understand the role that food banks can play in addressing social determinants and structural determinants of health in a way that's going to ensure the people that we're serving are better off in the long term. Some of the lessons learned as I just wrap up here is really just to start small. We know that these partnerships can seem daunting, but we want folks to know that there are tangible activities that you can be doing with your partners to have a deep and lasting impact on food insecurity. So find who your champions are within the healthcare space and within community. Identify plans and goals where you align. Think through how the data is going to inform your processes. Ensure you're co-identifying and co-creating with community members themselves and integrating their voices within the initiatives that you plan to develop. And really just ensure you're taking your time to think through this. So we want to be very intentional about having, again, lasting impacts. And we know that it's going to take many, many of us to do that. So please don't think it's the responsibility of any one sector to solve the problem. It's a collaborative effort that can't be done unless everyone is involved. And I again, just really appreciate being able to have the space and time here to chat with you all today. And I think in closing, really just that we are bigger, better, and stronger together, and stronger than the sum of our parts. So please make sure you're leaning into the collaboration and integration within community as a way to really leverage the strength and the resources that already exist within the food bank network. And with that, I'm sharing my contact information, and I imagine we will have time for questions after, but I will turn it back over to you, Mitch. Thank you.
Thank you very much, Tracy. I'm in awe of the work that you helped to coordinate. I want to remind our attendees, we do hope for some time at the end of the presentation for questions. If you have questions, please put them into the chat. And next we'll move to Megan Grega to tell us more about the work she has been doing.
Thank you, Mitch, and thank you, everyone. Let me just pull up my slides here, and it is both Dr. Andy Goodbread and myself would love to tell you guys a little bit about what sort of community engagement and food access strategies that we're employing here in the Lehigh Valley of Pennsylvania. So first of all, I want to say thank you for hanging out with us on this gorgeous night, wonderful outside. So thank you for coming to talk about a somewhat not as happy topic, you know, food insecurity, chronic disease, and things like that. But I would like to start this off on a positive note by saying that one of my favorite quotes, kind of words of wisdom from Albert Einstein, is this quote saying that we cannot solve our problems with the same thinking we used when we created them. And I really feel that applies to things like the chronic disease epidemic and complex problems like food insecurity. We need to think out of the box and come up with ways that we can engage with our patients in the places that they live, work, and play. So to give you a little bit of an idea where we practice and where Kellyn Foundation is centered, we are here in the greater Lehigh Valley of Pennsylvania, which is a pretty large metropolitan community. We're actually the third largest population center, believe it or not, in Pennsylvania, behind Philadelphia and Pittsburgh. And what's kind of intriguing about the Lehigh Valley is we are a mix of a ton of different things. Like we are urban, suburban, rural. We've got bunches of different ethnicities and education levels. We've got colleges, we've got health networks. We've got a lot of great stuff. We also, unfortunately, have 8 areas that are designated as food deserts, and we have a lot of our community members and our neighbors that are struggling with food insecurity. The United Way has said for us here in the Lehigh Valley that well over 60,000 residents are food insecure, and that's something that impacts their lives and ours as physicians every day. This will just give you a little idea of the food deserts that are in here in the Lehigh Valley that Dr. Goodbread and I work with. But I also want to point this out for all of you on the call, that if you look at the bottom link there, this is the USDA.gov map that you can use to look at your own community. So you can pull this up, it's a free resource, and you just put in your zip code and you can get an idea of where are the areas of food insecurity where you practice. Now, these green areas are areas that are both low income and low food access. And these are the 8 that are kind of situated where a lot of the St. Luke's practices are, as well as where Kellyn Foundation tries to focus. Now, here's some of our adult health metrics here in the Lehigh Valley. And again, I'm going to point out the link at the bottom. So for any of you who are anywhere in the country, you can find out your own stats from countryhealthrankings.org. But for here in the Lehigh Valley, unfortunately, food insecurity is hovering around 10%. Now, the good news is that's better than when we started taking kind of paying attention to this back about a decade ago, because it was about 12% then. But I mean, we still have a lot of work to do. So this is a lot of people for us to be trying to get engaged with systems that can help. So Kellyn Foundation, of which I'm the co-founder and chief medical officer, is really all about not just food insecurity, but the whole concept of health, lifestyle medicine, changing the social norms in a community, and really impacting what we would think of as the choice architecture, which is the default options that you have available in the community around you. So we think about immersing neighborhoods, which we define as an elementary school catchment area. So we love using the elementary schools as the hub because that's a great way to reach out and pull in a whole lot of other partners and families. And we immerse those neighborhoods with this healthy lifestyle education that's interactive, also the fresh local food access, which we'll be talking about. But the goal is to make the healthy choice the easy choice, and over time really shift behavior in these communities by focusing a lot of resources in those places. Luckily, we also have awesome residents from St. Luke's that get engaged with all of the different parts of this strategy. So the 4 cornerstones of Kellyn are the Kellyn School programs, and we'll be talking about that, teaching kids about what is healthy, what's not the greatest healthy things to eat, about other lifestyle choices, physical activity, things like that, but especially really starting to try to shift their taste buds, shift their palates to healthier food options. There's also Kellyn Food Access, which is the Eat Real Food mobile market that we'll be talking about, and the Lehigh Valley Corner Store Initiative, which has to do with the corner stores or bodegas that are in these areas of food insecurity. Then we also have Kellyn Kitchens, which is all about cooking that we'll talk about, and Kellyn Lifestyle Medicine, which we will not talk about much today, but is also a very important piece of helping a community shift to healthier behaviors. So here's some pictures of the Kellyn schools and the Garden as a Classroom program. Kellyn serves 40 elementary schools here in the Lehigh Valley. We interact with about 10,000 students every year, and we love having the family medicine residents come out and help be a part of this teaching and training of the students. So you can actually see 2 of our residents here that are teaching the kids about how do you plant things like beans and squash, talking to them about the types of vegetables that they like to eat, you know, finding out about the kids, whether they have their own school garden or anything like that at their own home or in their community. And it's a great way for the kids to, 1, get to see doctors outside of doctors' offices. You know, like you often think, I don't know if I want to go see my doctor in my doctor office, but when they come to your school, it's just fun that you're getting the chance to hang out with them. Now, as far as food insecurity, though, these school gardens are really community gardens. And in a typical year, we will grow over 2,000 pounds of food in the gardens at the schools that we serve. That is then distributed out through the school infrastructure or with the Eat Real Food mobile market, so that people are able to enjoy the food that they're growing. Actually, our best scenario is when we have families that get engaged and actually harvest the produce and distribute it through the neighborhoods themselves as well. Now, the Eat Real Food mobile market is another really important piece of the food access strategy. So you can see over here on the left, the Eat Real Food mobile market is about a 24-foot refrigerated trailer that we actually have 2 of these vehicles that we take out into areas of food insecurity here in the Lehigh Valley. So we go to the same sites every week. During the wintertime, it's about 10 sites a week. During the summer growing season, it's about 20 sites a week. And we bring the trailer basically as a healthy grocery store on wheels. So we'll have fruits and vegetables. We have nuts. We mostly have like seeds and legumes, whole grains, and also healthy prepared lifestyle medicine meals, which are like grab and go type of healthy food that people can take home, have for dinner, have for lunch, things like that. And the Eat Real Food mobile market accepts a lot of different types of payment systems. So definitely cash and credit, but also SNAP, the EBT program. We have double SNAP bucks, which is part of the Lehigh Valley Fresh Food Bucks program, FMNP WIC and Senior, and also the fruit and vegetable prescription vouchers, which we'll be talking about a little bit more. So by putting the mobile market in places where people are anyway, we can make the healthy choice the easy choice. Most of our sites are either at elementary schools, in the middle of some of the downtown areas at places like on the greenways or other areas that people are congregating anyway, or senior centers, which is another really important demographic that we want to focus on. So you can see over on the right, some of the residents that were out on the greenway with us, helping some of our wonderful customers choose their fruits and vegetables and their meals for the day. Now, Kellyn Kitchens is actually an interactive whole food plant-based cooking class series that we do out in the community. So we do them at elementary schools. You can see over there on the left, we're in one of the school cafeterias. We do them at senior centers, which is what you can see over on the right. And we love engaging the residents as part of this program because not only does it help them with their own kind of healthy meal prep skills, but it makes it a lot easier for them when they're counseling patients to kind of have that hands-on experiential knowledge of like, how do you make hummus or how do you make this, butternut squash soup that we were doing. And it's also a great way to really encourage multidisciplinary teamwork. So in these pictures that you see here, there's a bunch of medical residents, but there's also some medical students, some college students, and obviously the kids also having a great time eating. I love the look on the face of that one child with the kale going, what am I doing? But they do end up eating it. So that is the most important part. Now, lifestyle medicine meals is another really important piece from the Kellyn standpoint for changing behavior. And what this is are meals that are made back in our commercial kitchen that are whole food plant-based, very affordable and delicious, but convenient because you can pick them up at any of the mobile market sites. You can also get them at our home location. We have delivery options to things like the elementary schools and some of the other organizations in our area. And you can see some of our residents here. They come and hang out in the kitchen and learn about making falafel power bowls, or our resident here on the left he got to choose what he wanted to make that day. So he made a seasoned cauliflower steak with smashed potatoes and roasted green beans. So sounds delicious. What we really want to do with this type of program though, is to kind of counteract the feeling that people often have where they say, I would like to eat healthy, but I just don't have the time. It's not convenient. I don't have the time to cook. How do I get all the ingredients? We do have the ingredients on the mobile market, but the convenience standpoint is sometimes an obstacle. So we decided to start making these types of meals also to show that healthy food doesn't have to be that expensive, to be able to kind of have people have that healthy choice be the easy choice, but also to use it as an educational opportunity for the residents and for the community at large. So this just gives you a little bit of an idea of the impact of the Eat Real Food mobile market and some of the Kellyn food access initiatives that have been going on since 2016. And like I said, the residents come out into the community with us, talk to the customers, get an idea of how do you actually start talking to people about the recipes, changing their food choices. Again, as Tracy said, from a ethnically sensitive or culturally sensitive way. Like some people really love food that is spicy and has jalapenos in it. Other people, that is not where they're going to go with it. So really getting to know your customers and know your patients makes it a lot easier to be able to help shift them to some healthier food options that are still comfortable within the cuisine that they're used to doing. But we started the Eat Real Food mobile market back in 2016. And over the past 6 years, you can see the growth in the pounds of produce that we have sold in these areas of food insecurity during that time frame. And part of what these numbers say to me as a doc, but also as somebody who's really, really interested in behavior change, like how do we help people make that change, is that relationships are the most important thing. And continuity, staying in the communities, because we've been in the same communities now with the mobile market for 6 years. So people know us, they're friends, basically. They come and hang out and talk to us about what's going on with their lives and their medical issues, but also, hey, they just got a chance to try this new, recipe or whatever. What do we think about it? It becomes an event, it becomes like part of their social structure as well. And I would encourage for all of you who are thinking about, how do I start to engage with my community? I think Tracy said it really well, calories are important. And we've always thought that, some food at least would be a very helpful thing to do. But when we look at how do we change behavior over time, ongoing relationships with patients and having it not be like a one-off, one-time event, but having it happen over time really makes a big difference in the way the patients will engage. Now, this is one of my favorite slides because it looks at a thing that health networks can really get involved in, and that is fruit and vegetable prescription vouchers or healthy food prescription vouchers. It doesn't just have to be fruits and vegetables. So Kellyn Foundation has partnered with multiple organizations, including St. Luke's as one of our awesome funders of that, and some of the other health networks, the counties, other mental health providers, where patients are identified either because of a chronic disease state or because of social determinants of health with the vital signs screener, that these are people who could benefit from having a weekly access to healthy food, usually fruits and vegetables. And you can see what the patients are able to do is then actually come to the mobile market either in person and use their voucher, or they can order online and just come and pick it up. So it can be very convenient. We also have so many different sites, the 20 sites throughout the Valley. They can come to whatever site is most convenient for them that week. So it gives them a lot of flexibility and options. And you can see the growth over the past 3 years of how the uptake has been and the impact of the fruit and vegetable prescription vouchers. So I would love to encourage people to think of that as an option. We as physicians often write medication scripts. We usually do not have the ability to write scripts for our patients for healthy food, but that's something that we can start thinking about as how do we mobilize the resources of the healthcare system to be able to provide not only the medications, but also the healthy food for people that it would really benefit. So I put this slide up just to give you an idea of the types of foods that people, or the types of fruits and vegetables, I should say, that people are purchasing from the Eat Real Food mobile market. And this is the top 10 fruits and vegetables that we sold last year by weight. So the fact that lettuce is at the bottom of the vegetables does not mean that we didn't sell that much lettuce. It's just a very, very light type of a vegetable. But what this says to me more than anything is that people want variety, and they want to be able to choose the types of foods that are appropriate or enjoyed by their family. And we have seen with Kellyn Foundation over the years, we've tried multiple different ways to kind of like impact this issue and connect with people about healthy food. And from an engagement standpoint, what we have found is that the most effective thing is for people to have a variety of healthy foods to choose from, that they get to pick what is going to be most likely to be palatable for their family. So as we've seen with the growth in the fruit and vegetable prescription voucher engagement, because those were unique customers, not number of vouchers that were sent out, but also when we see returning customers, people being able to choose what sort of fruits and vegetables or healthy lifestyle medicine meals really makes a difference in continuing that engagement. We also have been able to provide senior food boxes. And, a lot of times we think from our senior population, it may not be a food insecurity issue as far as from a financial standpoint. It may be, definitely, but a lot of times it's a transportation issue. So they may have somebody who could take them to the store once a month or maybe once every 2 weeks, but it's difficult to access fresh produce that way. It doesn't last that long. So senior centers are one of the places that Kellyn Foundation brings the mobile market. And we love it when the residents can come because the seniors have so many questions that they would love to talk to them about when they're ordering their food. This is just an example of some of the senior food boxes that we were able to do last year, in addition to our normal mobile market site visits, being able to just kind of encourage people with that healthy produce at times that were kind of stressful times during the pandemic for people. So that was a huge, huge impact, but more than anything, I think it was the smiles and the interaction with those seniors. It's a way to do it outside of the clinic. And this is just an example of actually a partnership between Kellyn Foundation and St. Luke's with a diabetes program population. It was started as considered as a weekly fresh produce pickup at the actual clinic. It's a family medicine clinic, combined with some other healthy lifestyle activities like physical activity and some other services. And the initial participant goal was 80 customers, or 80 patients, I should say. And that was supposed to go for a year. And initially, they were able to recruit 34 patients to this study. But with the initial way that the program was set up, it was a non-choice option. Like you would come once a week, you'd pick up whatever bag was available. And there was a variety, but the patients didn't know ahead of time what they were going to be able to come and pick up. And so at that point, we were only getting about 10 patients a week that were showing up regularly. So we switched it to a choice option in January of 2021 so that patients could order ahead of time of fruits and vegetables of their choice and come and pick it up. And the graph below just shows kind of like the growth that we're seeing since that has happened. Now, part of it is also that the relationship thing again. Once you get it started and people start coming, they realize it's fun to come hang out and talk to the clinic staff and everything. But again, I would encourage, as you're thinking about how you structure these interventions, we all as docs and as people who are trying to make an impact in the community, we come up with or spend a lot of time trying to like make these programs work and get funding for them and everything. And I would encourage thinking about how do you make it as easy as possible for the patients and make it so that they have some part of a engagement in choosing what they're going to be able to pick up. So this is just a slide showing the partners for the Healthy Neighborhood Immersion Strategy, because it takes a lot of people to be able to get this type of an intervention off the ground. And so we really appreciate all of the time and treasure and talent that people are willing to share with us. But I think the concept of a immersion strategy, a wraparound sort of intervention to neighborhoods, is a very appealing sort of an idea, because you can really see the change over time by focusing a lot of resources on specific communities. And now I just also want to share that there's some other really cool things going on at St. Luke's with food access projects with the residents and everybody that are not related to Kellyn Foundation. And I would love for Dr. Goodbread to spread the word about the good stuff that's happening.
Thank you, Dr. Grega, and thank you for everything that Kellyn has done. As you can see, they're such a huge partner for the network and also for our program. Being our partners for lifestyle medicine has really allowed our residents to get that boots on the ground experience that really allows them to talk the walk and talk the talk to some extent. So when they're speaking with patients, when they're speaking with community members, they can speak specifically about the organizations that they've had a chance to work with and can connect patients with organizations that we actually know and love, rather than just have a handout for them. So a couple things here. So we have a relationship with the Rodale Foundation, with the Rodale Institute, who are pioneers in organic farming. And we have a small organic farm hosted by Rodale right on our Anderson campus, which is a nice chance for our learners to spend some time on the farm, where we're able to utilize community sourced agriculture shares for our employees, for our residents. We're able to utilize that for research studies where it's given directly to patients in various capacities, which is a whole talk for another time. And it also allows us to better partner with our patients in understanding what the rationale is between healthy eating. The other organization that's mentioned here is Project of East, and this is on there to really represent how we can take community engagement and also have it be leveraged in connecting patients with care, and also a resource for obtaining food for the food insecure. So the way we have it built within our program is that we have a strong relationship with Project of Easton, which is a community-based program that does literacy training, GED training, but also has a very strong and active food pantry. So once a month, our residents go and spend some time there doing some very basic counseling on nutrition and physical activity to those who are waiting to pick up their shares from the food pantry. During that time, we also chat with them, do some basic blood pressure and blood sugar screening, and then can connect them with visits in one of our residency offices if they don't have a primary care physician. Now, the key here is that it's longitudinal. This isn't a once and done experience. We have our residents coming back month after month to build that trust in who we are and that we can better understand what the organization is doing. That has been a really nice growth opportunity for us as a program, and it's very fulfilling for the residents. It's also an example of how primary care practices and residencies can partner with groups that could potentially supply produce for distribution right in their offices, which is something that St. Luke's is currently piloting, is to partner with organizations that could provide, again, fresh produce to either park their eat real food mobile market right outside of the building, or even be able to hand it out within the practice. So in order to leave some time for questions, I'll stop my portion of the resident engagement piece and the St. Luke's initiatives there. And why don't we unshare this and go back to finish up our case.
Thank you, Andy, Megan. Thank you,
Sounds good.
Tracy. I have many questions that pop in mind, and we've got some in our Q&A as well. But let me start by asking, I mean, you've shown us awesome work that you're doing both on a national level and
Mitch,
a local level.
Excuse me, Mitch. Could I do the closing of the case there? Could I share my slides for just one
Well,
moment?
that's what I was going to ask you about, Andy.
Yeah. Oh, great. Oh, I'm so sorry.
Okay, go ahead.
All right, thank you, Mitch. So just getting back to Adam, sorry, I just wanted to make sure we got a chance to close up this story because it's such a cool one. So back to Adam. So a member of our team who is well-versed in what we had to offer worked to set Adam up with our Hispanic diabetes support group, through which he was eligible for the fresh fruit and vegetable prescription voucher to be used at the Eat Real Food mobile market. And Adam actually became so engaged with the mobile market team that he would just hang around, engage with other members of the community as an ambassador for the service, and often would like walk them down the street to the Eat Real Food mobile market to redeem their vouchers. And over the course of a year, Adam lost 50 pounds, was able to stop 2 of his diabetes meds, and he's still a regular customer. So while he certainly isn't representative of every patient that we see, he is I would say the poster patient, the poster client for how this can be done really well when you have the right organizational partners and the right infrastructure built. So I'll unshare that so that Mitch can lead us into some questions. Thanks for your patience there, Mitch.
Thank you, Andy. That was my first question. A second question, and then we'll see if we get some in our chat. And we have just over 5 minutes, so we have time for a few. I am feeling like I want to do everything you're doing. I want to hook in with the Feeding America program, but how do I begin? Some of the things I heard are, check out your local county health rankings, go to the USDA.gov to look at food deserts. So I think that's a good place to start. But then in terms of programming and connecting, do you have any advice, Tracy or Megan or Andy, for a program that's just starting to address this problem?
Yeah, absolutely. I'm happy to start it off. So I think have a conversation. I would be interested to hear from folks, have you had a chance to connect with your local food bank or food pantry to understand what they're doing? Chances are they have already done assessments and have understood what the data is around food insecurity and health outcomes. So really just being able to sit at the same table and have a conversation around what the possibilities would be my initial recommendation for how to get started.
And Tracy, who would you do that with?
I think it's going to vary from food bank to food bank. Generally, it's folks who are on their food bank programs teams or health and nutrition teams. I think it's really just going to depend on the size and scope of what the food bank is doing. But generally, food banks have lots of information on their website and how to contact them, and they can connect folks with the appropriate staff members to start to have those conversations.
Great, thank you.
And I would also say, in addition to the food banks, looking into what sort of community agriculture options are around. So school gardens, community gardens, churches, or places of worship often will have gardens that they are taking care of. There's an organization called Grow a Row, which asks for people in the community that they grow an extra row of produce in their gardens and then donate it to local, and it could be a food pantry, it could be a church, it could be something like that. So looking into what sort of ways where people could even potentially start getting into growing some of their own food or picking up food from a community organization is a great way to make those connections in a community so that people are not only, potentially they'll start growing some of it themselves at one of the community gardens or the school gardens too. Andy, did you have any things to add to that?
Yeah, I would say that a good place to start is just making sure that you know what trenches have already been dug before you start to dig one of your own. So if your organization has a community health department, a community health department within your hospital system, is see, do they already have pre-existing relationships with any of the organizations that address food insecurity or any of the local food banks? Because if your goal is to connect patients or to even implement it into your own practice, there may be some infrastructure built already. So no need to reinvent the wheel if folks have been putting them on chariots for a while.
Mhm. I have another question here about broaching the subject. Is there shame? Is it something a patient doesn't want their healthcare providers to know, so they may not be offering it? Is there embarrassment on the provider's end? How do you handle those aspects of trying to help patients who may be embarrassed by their plight?
Yeah, I've been very impressed with the implementation of our social determinants of health questionnaire that's just done as part of intake for our patients, so that it's done in a way that just feels like part of routine screening, right? We're doing your vital signs, we're doing your social determinants of health screening, so that there's not that need to be the first one to venture that you're having food insecurity issues. You can just include it in your questionnaire. So that takes away some of the shame.
And I'd also say that when you can get out into the community, and that's part of like what the Kellyn Schools program that the residents come out and teach in, or some of the other just activities where you're not within your office, you'll often have then people come and talk to you about, like, so for example, we'll be teaching the kids about, hey, you should be eating at least 5 servings of fruits and vegetables a day. And then a child might say, I can't get fruits and vegetables because we don't have that in our home. And then you can work through the school to find out, okay, how can we connect with the parents and connect that way? So I think in the clinic is a very, very, very important way. And then whatever you can do out in the community is another really important way to do it.
Great. We have 1 minute and we have one final question here from Eric Ruth. There are many food insecure families that do not go to pantries. How do you address those families?
Well, Eric, I would like to say that we have the answers, but we don't have all the answers. I think that's part of the exploration for Feeding America's Health Innovation Team, or innovation team more broadly, is that we know there are a lot of individuals who don't access the charitable food system. And so we're trying to understand how we might be able to assess those needs and how we might be able to reach those individuals where they are. So I think we still have a lot to learn. We don't yet have the answers, but there are some practices that are currently existing within our food bank network around creating just-in-time kind of food lockers to support individual access. It's kind of like the Amazon model of having the lockers kind of set up in different locations. That's a strategy that's being tested, and there are some other ideas kind of generating right now as a network that we're really hoping to understand how we might be able to meet those individuals' needs.
Great. We do have a comment from Khushbu Jain, and I think we'll end the webinar with this, but Khushbu writes, we are starting to pilot some work with healthcare partners. We actually addressed something similar in our service area with an outpatient dietitian who has started using vital signs screening as part of her care provision. If a patient does screen positive, She has a family meal box provided from the food bank, packed in a MyPlate fashion as the emergency response, and then a referral process to their closest pantry. So one good suggestion on how to introduce the idea of pantries. Well, we promise to stay on time. Thank you, panelists. Thank you, everybody, at the end of your days or during your dinner times, joining us during this presentation. Very thought-provoking, and hopefully you'll help many of us take paths similar to what you've shown us here. Thank you.